And what we want to do is we want to talk to Representative Allyson Schwartz, who has joined us now on the Young Turks. Representative Schwartz, thanks for joining us.
Hello, how are you?
I'm very good. First, how do you feel about, instead of getting Medicare plus 5, this bill looks for negotiated rates, or has negotiated rates, where the government negotiates with the healthcare industry in setting the rates?
Well, I'm comfortable with where we landed at the end of the, all of the discussions and inputs with so many different members, and I was initially thought that the negotiated rates would be a good way to go, but we've also made a lot of, we had a lot of discussions in between and really wanted to make sure that rates were fair across the country. There are real disparities in the rates that Medicare pays the hospitals, doctors. There's some concern from a variety of sources that we should do a better job and it would be more attentive. Once we made a commitment to fixing that, I thought we could go to Medicare plus 5. It was certainly a cost saver to the taxpayer and would hopefully help contain the rate of growth and costs. We ended up back at negotiated rates, but I'm actually comfortable with that, given all the other things we're doing in this bill, and it leaves quite a bit of responsibility to the Secretary of HHS to make sure that she stays within the budget when she negotiates those rates.
Congresswoman Schwartz, now that we have this compromise, is it a done deal? Are the Blue Dogs and the Progressive Caucus definitely on board for this?
No, I can't speak for every member of Congress. As you know, I'm a New Democrat, a centrist Democrat, strongly supportive of the public option, and many of the other provisions in this legislation. I do believe that we are going to have a strong majority of members from across the caucus voting for this. Really, again, we really have tackled the major issues before us, which is finding a way to help all Americans be able to purchase insurance, including a public option so that these competitive rates and real choices for Americans, a way to drive improved health care and better outcomes and contain the rate of growth and cost of health care for all of us. So I think this is really a bill that works very well for American families, for American businesses, including small businesses, and helps us strengthen and meet our commitments under Medicare. So it's a good day for America. We came to a very good compromise. We now have to pass it in the House, of course, and then we have to reach compromise with the Senate once they pass their bill. So we're going to get this done. We're going to get this done.
And so let me ask about that. If you guys have the version where it's negotiated rates and they have the version where it's opt-out, can you do both, or does it have to be one or the other, and how does that work?
So, well, we have an opt-out provision for physicians, but we're still in the House. We're not, at this point, comfortable with the idea that states would opt out. We want to make sure that all Americans have access to affordable health coverage that works everywhere across this country. So there's still some discussions to be had. We're going into conference with a very strong bill for America.
And, the Republicans say that this is going to cost the American taxpayers a lot of money, and Joe Lieberman says the same thing. But the Congressional Budget Office says this version of the bill saves the budget $30 billion, so it takes away from the deficit. Now, it's kind of a funny question to ask you, but do you know what the Republicans' answer to that is? What do they say when you guys point that out?
Well, you're absolutely right. You should really be asking someone on the other side on this. But I have to say that we worked very hard. Initially, my goodness, the president really reached out to the Republicans, went to visit them on the Hill, went to visit them there on the Senate side in particular, but really reached out. We've incorporated a number of good ideas that I think that the Republicans would support. But by and large, they've said no to just about everything. And just the other day, they stood on the floor, one after the other, almost 100 of them, really talking about why they didn't want to proceed on health care reform in this way. And so they're going to find a lot of reasons not to be for this. We were hoping they would find some reasons to not be for it, but we were hoping they would find some reasons to be for it. And
now, those are the Republicans, but Joe Lieberman calls himself an independent Democrat on the Senate side, and then he has threatened to join a Republican filibuster. And he says the same thing. I mean, it appears to us that he's making stuff up, that it's going to cost the taxpayers money, that it's going to be a problem for the deficit, that it's going to make the premiums go up, the public option is going to make them go up. So how do you deal with a problem like Joe Lieberman?
Well, that is a problem in the Senate, I think. And again, you'd have to ask Senator Lieberman to justify some of the things he said. Let me say this. I'm also the vice chair of the Budget Committee, and I am deeply committed to making sure that we act in fiscally responsible ways and that we drive down the rising rate of growth in costs. And that's one of the things we do in this legislation as well. And, we have to make some investments, and I think one of the smart things to do is to make sure that all Americans have health coverage, and they have coverage for primary care and early intervention and better care for treatment of chronic diseases. All of that should reduce costs over time and reduce the cost to the budget as well as to family budgets as well as the federal budget. So, I understand that what Republicans are saying is it's going to cover more people. It's going to cost money. How do we know for sure we can contain those costs? We can't take the risk. Let's not do anything. I don't think that's the answer the American people want.
We're talking to Congresswoman Allyson Schwartz from the 13th Congressional District of Pennsylvania. Let me make it relevant to you in the House. If the Senate side says, well, look, we had to appease Joe Lieberman, so we took the public option out, so now you're going to have sign a bill without one, how would you react to that?
Well, I will say this. I am working hard to keep the public option in the bill. I believe that it will be in the bill, and it's going to be in the House version. And we've heard from Senator Reid that he's committed to making it work on the Senate side as well. That's where we are right now. That's where I hope we will be at the end of the day.
All right, and I want to ask you about one specific in the bill, which is the 12-year grace period now that drug makers get for what they call biologics, and how they're going to have basically a patent and a monopoly for 12 years. Congressman Waxman argued for 5 years, and that saved the taxpayer a lot of money earlier in 1984 when he made that agreement with Orrin Hatch on prescription drugs. In the beginning, the industry was only asking for 10 years. The White House was asking for 7 years. Why that enormous 12-year period where they get to make money and that eventually costs the American taxpayer more money?
Well, I actually was supportive of this biologics, and while I'm also very supportive of generics as well. We know that does give people money. But let me say this, I'm also very well aware of some of these new treatments do cost quite a bit of money for development. A lot of money goes into that research and development, and particularly in the area of biologics, it's a really a new field to find those generic biologics. It's a little different process and a little more complicated process than when you're dealing with standard, chemical medication.
No, we understand that, and that's why some period of a monopoly makes some degree of sense. 5 years, I mean, if you want to go crazy, 7 years, but 12 years allows them to make $386 billion more. That basically comes out of our pocket in just a 10-year period. That's a lot of money, Congresswoman.
Well, we're not going away. We're going to see how things go. But certainly, again, I was supportive and understood that there might have been a compromise at the end of the day. But this is, the fact that Mr. Waxman did go along with this really speaks to his interest in finally reaching some agreement about this. By not doing anything, by not reaching agreement, which is really where it stood for several years, we weren't moving down the road at all towards follow-on biologics, and so we were really putting it many years down the road if we didn't reach some agreement. So this is getting it going. That's important, and it's important for all Americans to have access to these new kinds of medications. And I'm excited about that.
Final question on that note. Time magazine notes that the biotech industry spent $110 million on lobbying. That's the equivalent of $609,000 a day going to Congress just in these last 6 months. Do you think that might have had something to do with it?
I think this was really given quite a bit of thought, and I know I was in meetings where we really talked about this and really how we would be able to move forward on it. I represent southeastern Pennsylvania, the Philadelphia area. There's quite a bit of biotech going on here, quite a bit of pharmaceuticals. I have a largest distributor for generics as well, and I have an interest in making sure that we can move forward.
All right. We lost you a little bit there, Congresswoman, but I appreciate your time and I appreciate your patience with us. Representative Allyson Schwartz from the 13th District in Pennsylvania. Thank you so much for joining us on the Young Turks.